My name's Libby Sinclair and I'm a Senior Speech Pathologist with the Communication and Assistive Technology Service, which is usually referred to as CATS. CATS is a small team made up of speech pathologists, OTs and rehab engineers, and we work together to come up with assistive technology solutions for patients with communication and mobility issues to help them be more independent in life. What we were finding is lots of patients were really interested in cloning their voice, but just weren't managing to get through the process of doing it, which is when you take recordings of your speech and use them to create a digital copy of your voice that can then be used on communication devices or phones and computers if you can't speak later on. So I applied for an innovation internship with the East Metropolitan Health Service innovation team. The aim of the project was to just give me some time away from my clinical duties so that I could focus on working out what it is that our patients need at the clinic to deliver.
My name's Ash, I'm the Innovation Manager at East Metropolitan Health Service and I've got the best job in this organisation. Internships are all about finding clinicians who've got great ideas about how to improve our health service and helping them get those ideas off the ground and breathing some life into them. We've had little projects here and there that have been supplemented by AI, but Libby's project was the first one that was all about artificial intelligence and centred it at the heart of the project. It's been a big learning curve for us to learn how to implement AI safely in our health service for the benefit of patients. After her internship, Libby delivered a presentation to leadership at the health service, and now we have a business as usual clinic at East Metro.
So far we've had 36 patients referred into the voice cloning and banking clinic in the last 6 months. I think we've had about 15 voices preserved, and I think we've got another 15 already in process as well.
My name's Lisa and I am living with motor neuron disease. This disease can take so much from us, so I think this is really important if we can keep our voice and it be that part of who we are. So if it ever comes to the time that we do need the tools for the speech, then at least it's you and it doesn't sound like a robot, and I think that's what was really important to me.
Here's a sample of a ready-made digital voice.
Hi, how are you going? It's so good to see you. It feels like it's been ages.
Now, let's listen to Lisa's cloned voice.
Hi, how are you going? It's so good to see you. It feels like it's been ages.
Your voice is so central to your identity, and being able to retain those unique elements of your voice when you move to using communication devices is really key part of maintaining your sense of self. The recording sessions where I capture patients' voice is the best part of my day. So in order to get a good voice clone, we need to get a nice natural recording. So we don't want people just reading a book. So we've created some really nice prompt questions to get people telling stories. None of my patients have had boring lives. I think generally when you're confronted with needing to create a voice clone, it's usually after quite a confronting diagnosis. People were initially shying away from creating voice clones because of having to think about the loss of voice it's a scary thing. But actually when you sit down and put down your memories and funny stories, you actually create a recording that is something that you appreciate and that your family have as well.
In innovation, excellence isn't perfection. Excellence is just giving it a go. We iterated and learned and made it a little bit better and a little bit better, and maybe we went down the wrong path and then we brought it back and tried something new, and we did try lots of different pathways to get this clinic to life, and probably where we finished is not where we thought we were going when we started. But what we do have is a clinic live, business as usual, helping patients in the hospital.
I think the CATS team demonstrates excellence through our passion and dedication to assistive technology and our patients. I think it's a real calling for all of us. Excellence to me personally is having a passion and a drive for the work that you do. I think we're a really patient-focused service, so coming up with practical solutions that we know are going to be safe, accessible and make a real difference to people is what we do every day. And we're so fortunate to be part of the Health Technology Management Unit and the East Metro Health Service.
If you'd like more information or to explore what options suit you best, please reach out to the CATS team. We are here to help.